Today we're going to study about teratogenic side effects of psychiatric medication. It's an important topic for clinical practice and also for when you take a test, these concepts are regularly tested. So we want to make sure that we have good understanding of medications and their teratogenic side effects. So let's start with Depakote or valproate. It comes in category D or X. Things you want to remember are neural tube defects like spinal bifida, intellectual disability, and risk of autism. You want to avoid in pregnancy. And even if you give a patient who is not pregnant, a female patient, you want to put them on folic acid to prevent any neural tube defects if they accidentally become pregnant. Usually, we see that folic acid is given 1 milligram per day, but most recent recommendation is 4 milligrams per day. It may not be clinically tested in the exam, but when you're in clinical practice, I recommend putting a patient, female patient, pregnancy age group on folic acid 4 milligrams per day if they are on Depakote. Now, let's go to Tegretol. Tegretol has also similar side effects, which is neural tube defects. It also has fingernail hypoplasia and craniofacial defects. So anytime you hear craniofacial defects and fingernail hypoplasia, you can think about Tegretol. It has less risk than Depakote, but still should be avoided. Now you think about lithium. Lithium is tested also. You want to think about Epstein anomaly and where there is problems with the tricuspid valve. And you also want to think about nephrogenic diabetic insipidus as a side effect. Risk is highest in the first trimester, and you can do a fetal echocardiography. Now, when you think about Paxil, it comes in category D. You want to think about pulmonary hypertension and cardiac defects. So please, whenever pulmonary hypertension comes, think about Paxil. You want to avoid this in first trimester and use Zoloft or fluoxetine instead. And then let's move to benzodiazepines. This one can cause cleft lip and palate and floppy infant syndrome and neonatal withdrawal. Risk is greatest with chronic use and late in pregnancy. When you go to Topamax, it's used in migraines and also sometimes mood lability or weight loss benefit. You want to think about cleft palate. It's off-label use in bipolar and also as weight loss agent. Now let's look at first antipsychotics. They're mostly in category C. They can cause extrapyramidal side effect. Use the lowest effective dosage and second generation antipsychotics are preferred. Now SSRIs, it can cause neonatal withdrawal symptoms and pulmonary hypertension. Zoloft is preferred in pregnancy. Okay. Lamictal, it has lowest risk overall, but oral cleft palate things can come. Considered safe in bipolar depression. Now you want to think about stimulants. There is fetal growth restriction and potential CV anomalies. Use only if clearly needed. It means like you really want to, need somebody who is so inattentive. Always document pregnancy risk and benefit discussion, and document maternal risk if medication is needed. And for high risk, you can ask for consultation. Informed consent should be documented. So the way I would remember is for Depakote and Tegretol, both of them can cause neural tube defects, and lithium Epstein anomaly, Paxil pulmonary hypertension, floppy baby syndrome is benzodiazepines, cleft palate is Topamax, and those are the main things. But hope this helps. Thank you very much.